Good day everyone. My name is Daniel Sumawang and I'm a student nurse po from Tarlac State University from BSN 2B po. And for today po, I will be performing a performance evaluation checklist about the EINC or what we call as the Essential Intrapartum and Newborn Care Practice. So the description of our performance is that EINC practices evidence-based standards for safe and quality care for the birthing mother as well as the newborn within the 48 hours of intrapartum period and a week of life for the newborn. And now we will proceed to the purposes of our performance. So first, the first purpose is to provide a safe and quality nursing care for the birthing mother as well as the newborn. And for the second purpose, to practice recommended practices during the antepartum, intrapartum, and immediate postpartum period. And now, for the last purpose, to follow the recommended practices for in the newborn care. Okay, so we will now move on to our materials. So for the materials, we do need to have two sets of materials, and this will be discussed during the along with the intervention. So let's just say that there are two sets of equipments, one for the during the labor and the delivery, and the second set is for the physical assessment, the eye ointment, as well as the vaccines for the baby. Okay, and now we will proceed to our implementation phase. So we need to do in advance to make a decontamination solution by adding 1 part of 5% chlorine bleach to the 9 parts of water to make 0.5% of chlorine solution or decontamination solution. And we need to remember that we will be replacing this solution at the beginning of each day or whenever the solution is very contaminated or cloudy. And now we will be moving on to our next step, which is prior of doing the procedure. So first is, let me just show you that, for example, this is the 9 parts of water and we have the chlorine solution here. So we will be adding at least 5% of 5% chlorine solution to our basin. So this is our basin. So again, we'll be putting 9 parts of water, okay, the chlorine to make the solution, because this decontaminating solution will be used to decontaminate all the equipments that will be soiled in the blood or other secretions. Okay, so let me just tell you that there are we will be making two basins of decontaminating solutions. One is for the gloves and the other basin is for the equipments. Okay, and we will leave the disposed gloves and the equipments after 10 minutes, and the gloves should be disposed and the other equipment should be washed and dried. And now we'll move on to our next step, which is prior of transferring the woman to the delivery room. So good day po ma'am, my name is Daniel Sumawang po, and I am a student nurse po from Tarlac State University, no? And I will be your student nurse po for today. Is that okay po? Okay, so may I know your name po ma'am? Okay, ma'am Mina. So ask ko lang po for your birthday po. Okay, so your age po ma'am? Okay po, no? So, hingi lang rin po sana ako ng consent ma'am dahil po okay lang po ba sa inyo na isa pong student nurse po na lalaki yung magkakandak po ng panganganak niyo po ngayon? Okay po, so ask lang rin po ako ng consent because I will be touching po some various areas po ng inyong pong perineal area. Specifically po, I will be touching it po with my fingers po, no? So, okay lang po ba yun ma'am? Okay, so wag po kayong mag-aalala kasi lahat po ng gagawin natin is gagawin po natin professionally po. Okay po? Okay, so thank you po. And after that po, ask ko lang po sana if okay na po ba kayo sa position po natin ngayon?
Okay lang.
Okay, that's good po, no? And ask ko lang po, bago po namin kayo i-transfer po sa delivery room, gusto niyo po muna ba kumain? Opo, how about drink po? Gusto niyo po muna ba umihi? Okay, so hindi na po. So, inform ko lang po kayo ma'am no, sa ating pong progress ng ating delivery. So as of now po, 6 centimeters pa lang po yung ating pong cervical dilation. And kailangan po natin i-meet yung 10 centimeters po ng cervical dilation po natin, no? So, konting oras na lang rin po yung hintayin natin nun, ma'am. Makikita na po natin si baby. Konting hinga ng malalim, inhale, exhale, push, konting inhale, exhale, push. So, konti yun, lang na lang po yun, no, ma'am? Kayang-kaya po natin yan. Okay po? Okay po. So, for our next step, we need to proceed. For example, the woman has already been transferred to the delivery room. We need to prepare for the delivery. Okay, so first thing that we need to do is we need to check the room temperature of our delivery area. So I have put in here a wall thermometer. So as I can see, the temperature is about 26 degrees Celsius, which is it is a perfect temperature, which is uh, the labor room or the delivery room should be 25 to 28 degrees Celsius. And after that, we will be eliminating any air drop. So to test the air drop, we will need to use a piece of paper. So if the paper directly, fell directly into the ground, meaning we can continue with our procedure, meaning because there's no air entering the delivery room. And if the paper flew on either side of the delivery room, we should eliminate the source of the entry of the air, because this would help or this would help the baby that the air elimination will not be cause of a hypothermia that could also cause acidosis, brain hemorrhage, the coagulation problems, and infections. Okay, so let's test. Okay, so the paper dropped directly into the ground, and we will now proceed to our procedure. Okay, so next thing that we need to do is I need to ask my client again. So, ma'am, okay na po ba tayo sa ating position right now po? Okay, so that's good po, no? Kasi ito pong position natin ay tinatawag po na semi-upright position po, na ito po yung pinaka default po na position po during the labor po. Okay po? Okay. And after that is I need to provide some privacy lang po, no? So, wag po kayong mag-alala, ma'am. Well-preserved po ang ating privacy here and security, because wala pong basta-basta na nakakapasok po dito po sa ating delivery room, no? Only the doctors, nurses po na may handle po ng ating case, yung nakakapasok po dito. Okay po? Okay, and after that, we will now proceed to our next step, which is, ma'am, maiwan ko po kayo ng panandalian dahil kailangan po nating mag-hand wash bago po kayo i-handle. Okay po? So, for our next step, I will be doing the hand washing, following the guidelines of the WHO of the 1, 2, 3, 4, 5 procedure of hand washing. We need to take off all of our jewelries if we do have one. Okay, so we need to get a liberate amount of soap. Okay, so we need to open the faucet first. Okay. Okay. So we need to do the palm to palm first. Okay. Next is the fingers interlace. Okay. And the back of the finger. Okay. And after that is the fingers interlock. Okay. And after that, we will now proceed to both the thumbs. And for the wrist. And now we will rinse our hands. We need to make sure that if we're doing a medical hand washing, the water is flowing down to the fingers. Okay, now we will be drying our hands.
using the tissue, and we will need to pat dry our hands. Okay, another one. Okay, and lastly is for the to turn off the faucet, we will be using again tissue to turn off our faucet. Okay. And now we will proceed to our next step.
After that is I need to the prepare a clear, clean, as well as clean newborn resuscitation area, and I need to check if the equipments are clean as well as if they are in good working condition. And after that, we will need to if the equipments are within easy reach. And now we will proceed to our next step, which is I will now be discussing the what I said earlier about the two sets of equipments. So first set is it includes the gloves, our dry linens or towels. Next is the baby's bonnet. After that is our cord clamps. But first, before the cord clamps, we do need to have the oxytocin injection, then the cord clamps. Next is for our instrument clamp. And after that is the um, scissors. Okay, so here are the scissors. And lastly is for the two kidney basin. Okay, so these are the first set. And for our second set, we do have here. Okay, so first is we do need to have the eye ointment or the erythromycin. After that is the stethoscope. Here is the stethoscope. Okay, and after that, we do need to have the vitamin K vaccine for vitamin K. Okay, we do need. Next is the Hep B vaccine. After that is the BCG vaccine and the cotton balls and etc. Okay. Now we will proceed to our next step, which is I need to do a perineal flushing to our client using the antiseptic solution. So first, but we will be first washing our client's perineal area using the water, and after that we will be applying the antiseptic solution. Okay. Okay, so we'll be using the water, and next is the we will be using a gauze to wipe the perineal area. So okay, so mother, huwag po kayong mag-alala, naka-insert na po yung ating kelly pad. So yung mga water po na mag-drain po dito ay mapupunta po sa ating pail. Okay po? Okay, so mother, puka po tayo ng konti. Okay, so I will touch na po yung ating pong area. Okay po? Okay. Okay, that we need to dispose this. So leave this first aside. And now we will proceed to our next step, which is we need to perform hand washing, or we could just use an alcohol if we use a gloves. Okay. And now we will proceed to our next step. Put on the sterile gloves. So let me just do it now. Okay. First is for the um, non-dominant hand. And next is for the dominant hand. Okay, now that we put our gloves on, okay, so we will now proceed to our next step na po, which is the time of the delivery po, no? So, okay po, mother, malapit na po natin mailabas si baby. So, konting irino lang po, kayang-kaya po natin yan, no? So, explain ko lang po sa inyo, mother, no, na wag po tayong magpo-push kapag hindi po natin nararamdaman yung contraction po, no? Okay? And also po, pwede po tayong humawak sa side rails po natin kapag gusto po natin mag-push. And wag po tayong iiyak, mother, kasi hindi po ito makakatulong po sa atin, no? Okay po, so wag po kayong mag-aalala because I will be applying perineal support po sa inyo hanggang sa lumabas po yung ulo po ng ating baby, okay po? But for the meantime po, I will be putting po a towel po sa inyo pong abdomen or the chest area po para po pag lumabas po si baby ay madali po natin siyang ma-dry. Okay po? Okay. So, ready na po ba tayo, mother? Okay, so ready po, mother? One, two, three. Malaki nga pong malalim. Okay po, exhale. Push, mother. Push po. Okay. Konti pa po, mother. Malapit na po. Kayang-kaya po natin yan. Okay po, inhale po. Exhale. Push, mother. Push. Okay. Last na po. Palabas na po yung ulo ni baby. Kayang-kaya po natin yan, mother. Okay po. Inhale po. Exhale. Push, mother. Push. Okay po. We can stop na po. Nakalabas na po yung ulo ng ating baby, no? So, the next thing I will be doing po is using my first two fingers po. I will be inserting it po sa leeg po or neck po ng ating baby. And I will need to turn po yung head ng baby. Slightly lang po. And I need to pull him po pababa, no? Okay, para po mailabas po natin yung shoulder ni baby. And aangat na po natin si baby para po lumabas po yung kabuuan ng katawan po ng baby. Okay po? Okay po, slightly turn. Okay, hilain pababa. The baby shoulder is out and we will be pulling the baby upward. Okay. Baby boy out. So, time of delivery, okay, 7:45 a.m. Okay, so mother, baby boy po ang ating baby po, no? Baby po. Okay, and after that, kailangan lang po natin siyang, we will now proceed to our next step, which is for the first 30 seconds of the baby. So we need to dry the baby thoroughly because this will stimulate breathing, and we need to dry the baby's face up to the toes. Okay? Okay, so mother, i-dry na po natin si baby, no? Okay, so starting po sa eyes. Okay, so symmetrical po ang eyes ni baby. Well, yung nose po and yung mouth. Then yung head po, no? Okay. So next po is yung chest po ni baby or yung kanyang trunk. Okay, symmetrical din po. And sa feet po ni baby, and yung arms po ni baby, ay kompleto naman po yung mga daliri po, no? Okay. And after that po, we will be moving on to our next step, which is we need to remove the wet cloth to our mother. Okay? So, tanggalin ko na po muna yung ano po, no? Okay po. Kasi na-secret po ito ng mga blood as well as other secretions. So, pakita ko sa baby. Okay? After that is cover po natin si baby as well as lagay po natin yung kanyang bonnet po, no? Okay. Okay. And after that, I will need to check for the after that we will proceed to our next step, which is we will need to check for the client's, we need to palpate the abdomen of our client if there is a second baby. Okay, so palpate ko lang po yung ating pong abdomen. Okay po. Okay, so wala na pong second baby. Ready na po natin yung medication po para sa inyo pong injection po ng oxytocin po. Okay po. Okay, and after that, I will need to remove, I need to get the medication. Okay. So for this moment, ang inject natin kay baby is, kay mother is oxytocin. So this will stimulate po prevention of further bleeding po, no? Okay. So but before that, I need first to use a wet towel to wipe all the bloods and other secretions that is in my gloves. Okay. Dispose. Okay, and after that, we will need to inject intramuscularly our oxytocin. Okay, so mother, i-check ko po ito intramuscularly. Okay po. Okay, so inject, hold the shaft, aspirate. Okay, walang blood, medication. Okay, now that we are done, we will now remove our first set of gloves. Okay, and after that we will be checking for the any pulsations to the umbilical cord. Okay, so check ko na po yung umbilical cord. Okay, okay, so there's no more pulsations po na, so we can cut the umbilical cord na po. Okay po. Okay. So for first clamp, i-clamp po natin siya. So, tanggalin po natin okay, clamp po natin sa may first 2 cm po away from the umbilical cord. Next, the second clamp, the instrument clamp, should be 5 cm away from the base of the umbilical cord, and we will be cutting it not in the midway but in the near the plastic clamp. Okay. Okay, now that we're done, we need to set this aside first. Okay, and if there are any secretions as we cut the umbilical cord, we will need to wipe it. Okay. And after that, we will now proceed to our next step, which is we will need to um, continue or do the remaining steps of the active management of third stage of labor. So we need to um, remove the placenta into the mother. So to do that, we will wait for a strong contraction and controlling the traction and counter tracking the traction, counter traction, and continuing to the removal of the placenta. Okay, so mother, tatanggalin na po natin yung placenta po, no? So roll lang po natin. Okay, now that we are done, so what we're going to do is pull the placenta. Mas pull po natin na pababa kaysa po sa side to side. Okay, pugod ng pababa, side to side, then up. Next is from down po ulit. Pugod ng pull po natin ng mas matagal, side to side, then up. Okay po, last po is pull pababa, side to side, and up. Okay, placenta is out. Okay, and we'll be putting it to we will need to examine it first. Okay, so okay naman po yung placenta natin, complete po ito, and wala pong abnormalities. Okay, after the examination, we will need to place it or dispose it to a waterproof or leak-proof container or a plastic bag. Okay, and now we will proceed to our next step, which is we will be palpating the abdomen of our the uterus of our mother until firm. Okay. Okay, so palpate lang po natin, mother. Po. Okay. Thank you po. So, inspect ko lang rin po yung inyong vaginal area for if there are any lacerations po or tears, no? Kasi po, pag meron po, kailangan po natin itong i-repair, no? Okay. So, now we will proceed to our next step. We will do the perineal flushing to our mother. Okay, so to do that, we will be using this injection with a water inside. Okay, as well as we will be using our forceps and some cotton balls to wipe the perineal area of our mother and clean it. Okay. Okay. Next is okay, and last po, mother. Okay. Okay, thank you po. And for the next step po is maglalagay lang po ako ng underpad po sa atin po, no? Okay po. So avoid po na magkaroon po ng mga soil po sa ating pong bed. Okay po. So, please lang po natin, mother. Okay, that's good po. And also po, check ko lang po yung color ni baby. As well po yung yung kanyang pong beating patterns. Okay po. Okay. Okay, good naman po, no? So, okay naman po ba tayo sa position natin, ma'am? Okay, that's good po, no? So, after that is I will now remove po my second set of gloves after doing the hand washing. Okay, first is I need to Again, do hand washing. Okay. And now we will proceed to our last phase, which is the 15 to 90 minutes. The first thing that I need to do, I need to do a patient education for my client for the feeding cues of the baby. So mother, now na lumabas na po si baby, um, ang mga feeding cues po niya kung nagugutom na po siya is kapag meron po tayong nakita or na-observe po kay baby na nagmamouthing or nagliliking or tanging movements po, as well as yung alert po si baby and yung legs po niya and your arms is gumagalaw, kung meron mo pong tossing or meron pong mouthing, the wiggling, as well as turning po, no? And lastly po, kapag ang last po na indication para po malaman natin if nagugutom na si baby is iiyak po siya. Okay po? So, instruct ko lang rin po kayo for the proper positioning and the attachment po. So, for the positioning po, kailangan po si baby is nakasupport po sa ating nakasupport po ang kanyang buong katawan sa ating pong kamay. Okay po? Also po, kailangan malapit po si baby sa ating katawan. And next po is, si baby po ay, dapat yung neck po ni baby ay hindi po naka-flex. Okay po? And lastly po, if kailangan po yung ulo po ni baby is naka-face po sa ating pong breast. Okay po? Okay, so for the attachments naman po, kailangan po makita natin si baby po yung lower lip po niya, nagtuturn po outward. And next po is yung chin po ni baby ay nakadikit po sa ating breast. And next po, if si baby po is may nakita po tayong sucking na mabagal po and deep po ito and may pausing po. And also po kapag si baby po ay naka-open po yung mouth niya ng wide. Okay po? Okay, so for the next step po, pwede ko po bang mahiram po si baby? Okay po, so this is the time po para po ma-inject po natin kay baby yung mga medications as well as po yung mga vaccines, yung eye ointment po, as well para ma-physical exam na rin po natin si baby. Okay po? Okay, so paano natin si baby? Okay. We get our second set of materials. Okay. Okay, so first is we need to administer an eye ointment. Okay. Okay. So to administer the eye ointment, we will need to start at the inner canthus to the outer canthus. Okay, so ma'am, ito pong ipapahid nating eye ointment kay baby is to prevent po gonorrhea. Okay po? Okay, now that we're done, we will proceed to the physical assessment of the baby using our tape measure. Okay, so first is for the head circumference. Okay, natin konti. Okay. Just above the forehead. Okay po, so 33, which is normal. And move on po tayo sa chest ni baby. Just above the nipple level. Okay. 32. Okay, next is above the abdomen, above the umbilical cord or below. Okay, again, 32. And next is for the height or the length of the baby, starting on the baby's sole of the foot. Okay, going to the head. Okay, it's exactly 46 centimeters. Okay, normal range as well. And next is will be weighing the baby. Okay, 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 okay. So the baby's weight is about um, 3,200 grams. Okay, and that is in a normal range as well. And after that, we will need to document all the data that we have gathered. Okay, okay. And after that, we will now proceed to um, the injection or the administration of the vitamin B, as well as the hepatitis B and the BCG vaccine. Okay. Okay. So first, mommy is administer po natin yung vitamin K. So, ina-administer po natin yung vitamin K to prevent po vitamin deficiency as well as to prevent po hemorrhage and further bleeding. Kasi alam po natin na hemorrhage po or bleeding is one of the number one causes po ng child death po, no? Okay? So first, we will be administering po 0.1 ml of vitamin K and administer po natin ito sa left thigh po ng ating baby and para po malaman natin yung exact location po ng time na pag-injectionan po natin is i-divide po natin imaginally yung thigh po ni baby into 3 and we will pick po yung upper outer quadrant po ng thigh ni baby, no? Specifically po yung ating vastus lateralis. Okay po? Okay po. So we need to inject to the left leg. Okay. Next. Inject. Okay. After that, we need to fold the shaft. We need to aspirate. And there's no blood. Administer the medication. Okay. Dispose. And next is, mother, ang na-administer naman po natin ngayon is yung Hep B vaccine po para kay baby. This would prevent po hepatitis infection po ng hepatitis B virus po. Okay po? Okay, so i-administer po natin ito 0.5 po ml and intramuscular din po natin ito i-administer po sa ating baby. And also po, there's no specific area po na pag-i-injectionan po natin, no? Basta po sa area po ng thighs. Okay po? Okay. Okay. To inject. Pull the shaft. Then aspirate. Okay, there's no blood. Inject the medication. That we need to dispose again our syringe. And lastly is for the BCG vaccine. So mother, i-administer po natin ang BCG vaccine sa deltoid po ng ating pong sa may braso po ng ating baby, no? So gagawin po natin ito intradermally and ang amount po nito is 0.05 ml po, no? So we will make a bleb po or a deal sa ating pong baby. Okay po? Okay, so binibigay po ang BCG vaccine, ma'am, to prevent tuberculosis, infection of tuberculosis po, no? Okay? Okay, so administer po natin. So 15 degrees or just above the below the skin. Okay, okay, and to shove, aspirate. Okay, we need to administer it slowly. There's no blood. Slowly to make a wheel or blood. Okay, after that, we will now move on to our next step. Okay, so we will need to return the baby to the mother. Okay, so for example, here's the towel. We will need to cover the baby. Okay. Okay. Place the baby. First is we need to hold the upper area. Okay. Since the baby's bonnet was already in place, we will need to just put the baby's head out of the cloth, and we need to include the left arm of the baby to the cloth, but not the right arm. Okay. After that, we need to fold now the next corner of the cloth. And for the last one is we need to insert it in the middle. Okay, so ibabalik na po natin si baby sa kanyang mother. Okay po, mother. Bakang po natin si baby. Side po natin. Okay, so okay. Okay. After that, we'll now proceed to our next step, which is inform ko lang po si mother na mother, huwag po nating papaliguan po si baby, no? Huwag po nating papaliguan si baby within the 6-hour period po, no? To prevent hypothermia po, no? So, in-explain na po natin kanina kung ano po yung maaaring mangyari kay baby kapag nagkaroon po siya ng hypothermia. Okay, so yung nakikita po nating mga white po sa ating pong baby, ay wag po natin tatanggalin because ito po yung tinatawag na vernix po, no? And ito po yung magsisilbing protection po ni baby habang hindi pa po siya napapaliguan. Okay po? Okay, and after that po, advice ko lang rin po yung breastfeeding for demand po, no? So, pag nagugutom po si baby, lagi po natin siyang pasusuhin. Okay po? So, na-explain na rin po natin kanina kung ano po yung mga feeding tips po, no? Because po yung milk po ng mommy, yung po yung pinakamasustansyang milk po na pwede po natin ibigay sa isa pong baby. Okay po? Okay? Now, we'll proceed to the last 3 steps, which is for the first hour. I will need to check again the baby's condition for its color and breathing. Okay? And after that, I will need to check for the mother's vital signs. Oh, no? So, ito, baby. Okay, so okay naman po yung breathing ni baby. And yung color po niya is normal, which is pinkish po, which indicates po na circulate na po yung oxygen po sa buong katawan ni baby. Okay po. Okay, so kuhanin ko po yung vital signs ni mother. Okay po. hold lang po natin saglit. So, yun po sa mother. Okay po, check na po natin yung pong blood pressure. Okay. Natin po ito. Okay po. Okay. Okay, that's good po, no? Normal po ang ating pong blood pressure. Okay po. So, now we will be checking po yung inyo pong temperature. Okay. Okay. Okay, so normal din po ang ating temperature, mother. And check ko po yung inyong pong pulse rate. Okay po. Okay, after that is, okay naman po yung ating pong pulse rate, no? Within the normal range po as well as yung ating pong respiratory rate. Okay po, mother? Okay, and now we'll proceed for the first 2 hours. We need to um, check for the mother and the baby's diet for 30 minutes to 1 hour. And after that, we will need to complete all our records. And that would be all for the performance evaluation of the EINC or the Essential Intrapartum and Newborn Care Practices.